Welcome back, our dear viewers. You're still tuned to the Saudi Morning Show. We have just seen the economic updates and before that the stock market updates. But moving now to our discussion, our last discussion for today, where we're talking about dental problems in children. And joining us here in the studio is Dr. Abeer Marzok, the dental surgery. Good morning, Dr. Abeer.
Good morning.
It's a pleasure to have you here with us on Saudi Channel 2 for the Saudi Morning Show. First of all, Dr. Abeer, let me ask about a child. When we're supposed to take a child to the dentist, maybe for the first time, is after maybe 1 year, 2 years, or 6 months. What is the best time maybe to take the child?
Child must be taken early, within 6 months, according to American Academy of Pediatric and American Academy of Pediatric Dentistry. It must be within 6 months after the appearance of the first tooth.
She kept looking at the teeth here. That's for adults,
Yes.
No, they're 28. I counted them.
They are 28? Okay.
Yeah,
Yeah. We steal the remaining food.
But okay, I'll put this down because I'm staring at it too much.
I'm afraid.
Dr. Abeer, if we can talk about children and them and the importance of them going to a dentist. Now, according to some doctors, I've heard that you should take your child to a dentist as soon as the first tooth comes.
Yes.
So, for a child to actually go to a dentist when the first tooth comes, what is the process like? If you can just tell the mothers who are watching us, so maybe they would know what is it that the child would go through when they go to a dentist, because most of the times the parents are so scared, like what is going to happen if I take my child to a dentist who was just born? So if you can just tell them what exactly happens.
At first, with the start of eruption of the first tooth, babies sometimes have problems. They have painful. It come painful, so they must go to doctor to ask him what is the pain. Sometimes the children they have like fever or diarrhea with eruption of the teeth. This is not related to the teeth. This must go to physician, because all parents think that this is normal with the eruption of the teeth. The mother will go to the doctor, the dentist, so the dentist will learn the mother how to clean the mouth of the baby and to look for the teeth. It must learn here that every 6 months she come to the doctor. At first, all parents think that the baby, small baby, no need to clean the mouth. Since the start of delivery, the baby must clean the mouth. So the dentist is the one who learns this one. So with web gauze or clean finger,
yes,
or damp soft cloth, the mother must clean the mouth of the baby every time after lactation, when the start of the food, because the baby he don't know that they must use the toothbrush and not still early to use this toothbrush for the baby. So this is why the mother, this become education. Yani she must be adapted. This is a habit. She must go to doctor every 6 months.
Yeah, maybe a toothbrush will be painful if we use it with the little children. But do we need this much care? As long as we know, like after 7 years, the milky teeth all will drop and he will have another teeth. So do we need this much care, like
yes,
as adults too?
All our Arab countries think like this. Think it's not necessary to take care of the teeth of the baby.
Because I'm taking care of some teeth that will be fallen. Like
no, it will be fallen, but it will cause problems for the erupted permanent teeth, because the primary teeth is relevant for the oral health of the baby, for its future. So we must take care of these primary teeth.
Indeed. Now, Dr. Abeer, if you can talk about the fact that there are some things that actually affect the milk teeth, and as you mentioned, the child's teeth, even when they come off, they are somehow the main foundation for the permanent teeth to come. Now, let's say when the child has like a full mouth of the teeth, and there are some children who suck onto their fingers. There are some children who suck onto their fingers all the time. Then there are, of course, the kids who put in different things in their mouth for a constant period. It is like their habit. Now, if we have something in between our teeth the full time, does it actually displace the teeth?
Yes.
It actually does that. And is that some permanent damage? Let's say I put in my thumb. As a kid, I never did that, so I'm just talking about it as an example.
I make.
Yeah.
I did like this.
You did? Okay. So let's say we are doing that. So this is actually what's happening.
Yes.
You are pushing your teeth forward, your front teeth forward. So is this a permanent damage that we are doing
The problem that
as kids?
because the teeth, the permanent teeth, it follows the direction of the primary teeth. So this make protrusion for the teeth. And also it make protrusion for the premaxilla. So this affects the baby. Also, this is source of bacteria. The finger now, the baby use the finger or the pacifier. This is source of bacteria. So يعني, he must, يعني, the baby, this is a normal habit. It continues with the baby from 2 to 4 years. So this is normal. But if the baby is continuous after this age until 7 or 6 years old, this is problem. So in this case, we must treat this one. We must use mouth guard. Mouth guard, this is as a coverage for the upper and lower arch. This is no problem with the breast, no problem with eating, and also protect the baby when he start his activities. So from injury from the of the lips, from the teeth, or broken teeth, or damage to the
jaw.
To the jaw when he plays, so no problem. So must we take care? We must notice the baby in every behavior he make.
Yeah, and Dr. Abeer, as you mentioned, taking care of the child teeth. Let me ask about those from 3 years or 4 years to 10 years maybe. There are some toothpaste which are for children maybe. What do you think of this kind maybe of toothpaste? Are they efficient? Because it's like sweet or something, it's not that strong. This is how I look at it personally, but also
It's like candy.
yeah, it's like candy. And also how can we like encourage the kid every now and then to take care and like brush his teeth every now and then, every day, twice or maybe once at least every day, and like make it as a habit for him.
The baby imitates his father and mother, so it must be start from the family. If the mother take him every day and learn him how to use the toothbrush and how to use dental floss, how to use the mouthwash as a rinse, not beverage. First, toothbrush at first years for the baby, we use non-fluorinated toothpaste in the size of B, until the baby learn how to spit out the toothpaste. This is the first. The mother with at first toothbrush with water. There is soft toothbrushes and small and with nice shaping for the baby, so he enjoy. She must clean the teeth of the baby, or with web gauze. She must clean all the gums. Okay, this is the first. Second, non-fluorinated toothpaste. When the baby start to his activity and he know how to tie his shoes, the mother started to give him the fluorinated toothpaste and learn him that it must be at least twice, at least. It must be after every meal. Also, the mother, she must learn what to give the baby in between meals. Hard candy or breast mint, this is a big problem. Because the mother, she don't know that she give a chance for the sugar and starch present in the candy with accommodate with bacteria in saliva, so they make acid. This acid can protrude, can invade the enamel of the teeth. This is the start of cavities. Cavities meaning caries. So this is like a circle. So if the mother adapt her baby like this is normal. And also, the primary teeth is important for speech. If we didn't take care of primary teeth, there's a problem for speech, because The baby when start to learn speech, the teeth present in good alignment. This help him to his tongue for
Better talking.
syllable pronunciation, and also not the tongue come out. So the baby can have a normal speech formation, okay?
Right.
Also, the mother must learn the baby after the teeth completely, the 20, not 32, 20 teeth. The mother must learn the baby how to use the dental floss silk. This must be, this habit. He must be adapted. Toothbrush and dental flossing. Also a mouthwash with nice taste. Mouthwash, rinse, not beverage. So these things all will keep the baby primary teeth healthy until the eruption of the permanent teeth. It is a guide for the permanent teeth. Also, good oral hygiene, self-confidence for the baby, good smile, because the baby, he can notice that if he is ugly or not. He is human being. He is not live like this, no problem with his appearance, no.
Right.
And doctor, as you mentioned, for the primary teeth, they start falling at 7 years old.
Yes.
Yeah, but we used to when it starts to shake or to move, like it's not stable and it's about to fall. Should we seek a doctor, or could it be done at home? Because it's a longer procedure. He still got 16 more. So every time we should seek a doctor, or is some procedure that we can do at home in order to save it, remove and clean the area?
No problem. It can be at home if it is not a small part, because the permanent teeth, when come to erupted, it eats the root of the primary teeth. So no problem. This is for the baby. If it is, he can accept like this, the mother can remove. If not accepted and it's still in the gums of the baby, no, he must go to doctor. At least the doctor will put topical gel. Okay, and also the baby must be adapted that he is going to a doctor. He must have amusement to go to doctor, not like punishment, amusement.
Yeah.
But of course,
So
if
it's
the
like-
mother like you and he see you crying, this is problem.
Yeah, true.
I am not a
we make
mother
it
yet.
like fun for them going to the doctor. It's a good journey going to the doctor, and it's fun.
Yeah,
I'll
the
take you to the doctor, and he's
balloons.
so excited.
The balloons and the dentists don't give us candy, but the doctors give us candy. I have never gone to a dentist who ever gave me a candy, but they give
He
us
will
balloons.
not give you a candy, he will give you balloons. صح.
Yeah, they give us like a nice balloon. But Dr. Abeer, if we can just talk about the reason that there are some kids when their tooth is coming off and it's shaking, they would play with it all the time with their tongue, and they're pushing it and then they're pulling it back, and it's like a game for them because it's something new. It's like a broken finger. You want to play with it. Now, does that actually affect the growth of the permanent teeth that is going to come in?
No problem. No.
It's
No
not a
problem, no problem.
So you can play all that you want.
Until
it's
it
okay.
falls down. I like it. It's all done.
No, no problem.
But what is the percentage maybe when we take care of our kids and their teeth? How would be safe and protected maybe in the lifetime?
In lifetime, it will at least prevent the protrusion of the permanent teeth. Also, you will help your child to keep his teeth as long as. If the baby extracts his teeth early, sometimes they reach to the step of extraction. With the extraction, without follow-up from the dentist, there is a space. These spaces, the teeth will shift and move to close these spaces. So if the teeth close this will make bad alignment for the permanent teeth and bad shape. So the baby will enter from 6 to 12 and teens age until 19. He will need orthodontic treatment. This will cost more money. So if you take care your baby teeth, you will save too much money, too much. And also this is a big problem to have bad appearance, so no self-confidence, his social interaction very bad. many things. So we must take care of the primary teeth.
Now, doctor, because we're running out of time, we do not really have the time anymore to ask you more questions, even though we would like to. Can you just show the viewers quickly how to brush teeth?
Okay. This is our teeth. First, we use toothbrush after every meal and in the morning when we wake up, عشان bad breath. Okay?
At least 3 times to 4.
First, we start from the gingiva to the tooth. Every jaw alone, not together like this, like the neck. No, we must use from the gingiva to the tooth, from the jaw up to down, and in the lower jaw from down to up.
Sometimes so sensitive that the blood may come.
No problem. This blood is not good. So even 1 month continuous bleeding, no problem.
Okay.
It will stop alone. And after this, we take the posterior teeth also, and we come from behind and upper from behind to clean in between the teeth, to remove the black in between the teeth. Also, in the surface of the molars, we must clean from the molars, up and down, like this only. Don't make like this, they will enter in periodontal problems and gingival recession and
Yes,
the
many
roots
people-
exposed.
Many people found out that they've been doing it wrong. Like
No, this before me, myself, I make like this.
Yeah.
But
Like
with
painting.
training, yes, with training, you will adapt like this. This will be normal. You will not feel, at first it is difficult. After this, خلاص, no
Now,
problem.
doctor, another thing is this surface. I always tell people that you should clean this too.
Difficult, high vomiting reflex, how they clean, the saliva clean, but the tongue, only the
So it's
tongue.
okay if you don't brush this?
No,
I
no
brush this
problem.
every day, both.
How you rich?
Yeah. I can show you how I do it.
Okay, learn me, so I learn my patient.
it's only for the tongue. And with this, Dr. Abeer Marzok, the dental surgeon, would like to thank you so much.
Thank you.
Thank
I'm
you.
happy
And
to-
that was
thank
Dr. Abeer Marzok talking about taking care maybe of children's teeth and how to protect them and always teach them how to brush their teeth, as she just mentioned us for us. For now, the videos will stop towards our next break and we'll be back to you. Stay tuned.